My name is McCloskey. I'm a cognitive behavioural psychotherapist and an occupational psychologist, and I work for a private therapy clinic. I first decided that I wanted to become a therapist when I met a clinical psychologist in hospital when I was quite young. I was in for stress myself, and a lady came over and spoke to me, and I found out what it was, what her title was, and that's when I decided that's what I wanted to do. So the main approach that I use with clients is cognitive behavioural therapy. I'm also trained in compassionate focused therapy and acceptance commitment therapy, but I believe that every individual needs an approach to be tailored towards what it is their presenting issue is. So I enjoy working with binge eating, with bulimia, with anorexia, but also other anxiety disorders, so OCD, social phobias. I've also worked quite closely with bipolar and other complex issues, quite a few addictions as well, gambling, alcohol, and I've also worked with low self-esteem and anger issues as well. I think that it's important for therapists to have their own therapy. I think that going into this line of work can bring up quite a few concerns and issues that would be better addressed, I guess. It would also provide the therapist or the psychologist to experience therapy in reverse, I guess, because we spend so many hours of the week helping other people through their problems. It would be a unique experience to be able to have that for yourself. I believe that it's very normal to have psychological difficulties. To be human is to experience different ranges of emotions and have been through different difficulties. There are certain people that would be more motivated to access help, or maybe there'll be certain people that are more aware of their difficulties, and that would enable them to do very well in therapy. I am able to offer a wide range of techniques for someone to be able to reprogram the way that they've been living. A lot of the times when people come to me, they have gone into really deeply ingrained habits, and it can be very difficult for anyone to change those. So the techniques that I give them are able to address those. I think that a good therapist is empathic. They are a good listener, but I believe that being professional in the room is very important, but at the same time human. I believe that openness and honesty are really important as well. I guess to a certain degree it could be taken as being tough, but sometimes that's necessary to get someone to where they need to be. I also have a master's in occupational psychology, which I guess has better informed me to be able to work with work stress, with employee well-being, with issues that go on in a workplace. I'm also, I know a lot about leadership, and I'm also qualified to carry out psychometric testing, which is for occupational purposes. As well as English, I'm also fluent in Farsi because I've got a part Iranian background. I guess this has enabled me to work with quite a few Farsi-speaking clients in the past, which means that I'm able to and fully confident in providing therapy fully in Farsi. Working for the NHS and private therapy clinic in London has given me the ability to work with so many different cultures and backgrounds and religions as well. In my spare time, I like to read. I like to go to the gym, the other kind of popular things like cycling and walking I really enjoy. Mainly though, I like to go away. I like to go abroad. I like to take breaks. I think it's really important to be able to kind of recharge my battery, so I like travelling as well.